Okay, I'm speaking loudly. Elizabeth had energy, enthusiasm, a sense of adventure, and openness to life and all its experiences. She loved to read, to write poetry. She loved art and drawing. She wanted to travel the world to meet all the interesting people in it. Liz had a heart of gold. She was intensely empathetic. She took on the hurt of others deeply. She seemed to feel it was her job to make everyone feel better and feel welcome. These were some of the words spoken by her mother at the memorial service for my niece, Elizabeth, who died October 14, 2008, in a Connecticut hospital ICU at the age of 30. Elizabeth, or B, as my brother and her family affectionately called her, died of complications from pneumonia that I believe could have been prevented if she had access to health insurance before she ended up in the emergency room. Elizabeth lost her health insurance when she lost her job in the spring of 2008. She was embarrassed to tell her family of this loss and to ask for our help. The day she was rushed by ambulance to the hospital, she was researching jobs in her library in Connecticut, trying desperately to find another position that offered health care, but the growing recession was making that very difficult. When she lost her job, she couldn't afford COBRA, since that was a year before the stimulus package subsidized this program to help the unemployed. She hadn't been feeling well for weeks, but didn't want to worry her parents, so the regular calls home were always positive sounding. According to research done by Harvard Medical School and the Cambridge Health Alliance, almost 45,000 people die each year for no other reason than because they didn't have health insurance. That is 5 people every hour. These are shocking numbers. Shocking to know that so many deaths could be prevented. Each one of the 45,000 has names like Elizabeth, with families and friends who mourn deeply their loss. If the Patients Protection and Affordability Act had been passed 17 years ago, Elizabeth and many others could have had access to healthcare exchanges with objective comparisons of plans and costs with subsidies based on ability to pay, so that it would have been affordable. They would have had full coverage for preventative health care. If we had health care reform, there would be no pre-existing condition exclusions, lifetime maximums, or have insurance dropped unexpectedly when illness occurs. Healthcare plans wouldn't discriminate based on health status or gender. This could have been the world Elizabeth lived in, because most of these items were part of the Republican plan in 1993 that they are deserting today. In 2007, I helped found Bucks Voices for Healthcare Reform to study and inform people in our country about the national healthcare crisis. Little did I think this crisis would have such a profound personal effect on my family a year later. Bucks Voice's vision statement says, "Healthcare should be considered integral with the common good that promotes human dignity for all. Both individuals and society have responsibilities for healthcare. We as individuals need to protect our health, and we as a society need to provide a sustainable healthcare system." The legislation that is being voted on today is about providing a sustainable healthcare system. It is about fairness, the common good, and human dignity. In a country as great and compassionate as ours, it's wrong to have a healthcare system that allows access only if you have money to pay for insurance to see a doctor. It is like saying you can have police and fire protection if you have the money to afford security. We don't call police and fire departments socialized security. And what would our communities be without both? We know that what our society is like without health insurance for all. Too many young, beautiful Elizabeths die. This is our moment in history when change can happen if we who believe in compassion and fairness have the will, like Congressman Murphy, to make it happen. Each of you here and many others who couldn't be here this afternoon has played a critical role to get us to where we are this afternoon, inches away from passing legislation, as imperfect as it is, that will save future lives. This is a pro-life bill in the real sense of the word. No one should die because they cannot afford health care, and no one should get broke because they get sick. Congressman Murphy heard the voices and stories of thousands of people in this country and this county, and stood with us instead of the health insurance industry and their related stakeholders of the status quo that spent millions of dollars weekly to stop this legislation. The pressure has been intense. Our Congressman Murphy has the strength and moral character to do what is right and vote for the reconciliation bill and the Patients Protection and Affordability Act. Congressman Murphy will be making history today with his vote to fulfill a 60-year dream of health care reform. We have done our part, and Congressman Murphy is doing his part. So let us take a moment to bow our heads for silent contemplation and prayer that the rest of Congress does the morally correct act this afternoon and vote to give all citizens the human dignity they deserve and pass the Reconciliation Bill and the Patients Protection and Affordability Act. Thank you, Congressman Murphy, and everyone in the local level for your work that you have done in correcting myths, lobbying, rallying, writing, and learning the facts. And I know that Elizabeth is watching this historic day unfold. Thank you, too.